right, so moving forward in time again, so from 1996 to 2005, we had a couple of events happen. So the Balanced Budget Act occurred, which has to do with the Medicare cap, and I'll go over that on the next slide. There's a lot of events that occurred within the APTA. So the suspension of the Medicare cap has to do with the Balanced Budget Act. Again, I'll go into that on the next slide. A lot of new things were developed by the APTA. So there was a normative model for PTA education that was developed. There was a guide to physical therapy practice that was developed. Hooked on Research is an online resource for APTA members. The guide to physical therapy practice became interactive. And the PT programs were changed to at least a master's degree level. There was a change again in about 2003, 2004 for physical therapists to become doctorate level as part of the Vision 2020. So we'll get to a couple of those things in the next couple of slides. So as I mentioned, the Balanced Budget Act of 1997, so that's when it was passed within the legislature, and this was done to eliminate Medicare debt. So what had happened was Medicare felt that they were spending a lot of money on medical services, and they were in a lot of debt. So they developed this Balanced Budget Act. It was passed in 1997. It took effect in 1999, and back then there was an annual cap of $1,500 per beneficiary. So that means per patient for all outpatient rehab services every single year. And this was just for outpatient rehab services. They put caps on other groups within the healthcare field. So that meant that someone with Medicare insurance would come see someone for outpatient rehab services, and after they spent $1,500, that was it. Their insurance would no longer pay for that. So that had a really big impact on physical therapy and physical therapist assistant jobs. There was definitely a decline in the need for rehab services. A lot of people complained about this, so in November of 1999, they ended up suspending the cap for 2 years in all rehab settings. And then they ended up putting a moratorium that got passed 3 different times between 1997 and 2005. So a moratorium to basically try to stop this Balanced Budget Act to kind of delay this implementation of the Medicare cap. So you can see there's a lot of back and forth. Not everybody was in agreement about this therapy cap. They felt that it was really impacting patient care. What happened in January of 2006, though, was that they re-implemented this Medicare therapy cap, and that cap was increased to $1,740 for both physical therapy and speech services together. As of February 2016, the cap was set at just under $2,000, so $1,940, again combined physical therapy with speech. However, as of 2018, so a brand new thing that has just occurred, is they have completely removed the physical therapy cap on services from Medicare. There hasn't been an official word as to when this will take effect, but that is a good thing to have the cap removed. The other component of this cap, however, that will affect you as PTAs is that as of 2020, I believe, or 2022, there will be a decrease in the reimbursement for services of physical therapist assistants by 15%. So there's a lot of people that aren't happy with that component of the change, but there's a lot of petitions going around to try to change that and try to remove the cap. And the APTA is one of the groups that are definitely supporting that. The vision and application of scientific pursuit. So this really became pretty mainstream starting in about 2006 and definitely applies today. So this is basically just saying that within the field of physical therapy, we definitely use a more scientific method to our clinical practice and our clinical treatment. And this includes finding new evidence-based approaches, so interventions, treatments for preventing injuries, for promoting health, and working with our patients. So you may hear me talk a lot about evidence-based practice and evidence-based medicine because that is definitely a strong component of physical therapy practice. I mentioned this earlier, the APTA came up with a Vision 2020, and the goal with this was that by the year 2020, they would have met the following kind of objectives listed here. So physical therapy would be provided by a doctorate of physical therapy, PTAs would be supervised by a physical therapist, and PTAs would assist PTs in selecting different treatment interventions. So the purpose of this was to really elevate the profession as a whole and basically show that we are a highly educated group of rehab specialists. So 2020 is coming up soon, and I would say that we're pretty close to meeting these objectives. Another portion of the Vision 2020 was direct access, which I mentioned a couple slides earlier that all states have direct access, which is fantastic. So that's access to diagnosis of injuries, to get different types of interventions, to heal from an injury, to focus on prevention of impairments and other things related to their injury. So some of the things that you'll hear quite a bit in the next couple of semesters, we'll talk about patient impairments, functional limitations, and their disabilities. And these are three major areas that we look at for things to improve with our patients related to their disability or their impairment or their dysfunction. And for us as physical therapists and physical therapist assistants, it's related to their movement, patient's function, and patient health. There are a lot of different areas for physical therapists to work and practice. There are physical therapists that consult with insurance companies. These are usually PTs and PTAs that have had a lot of years of experience. PTs and PTAs can work in occupational health, so this has to do with employment. This is called work hardening. So a patient will come in, they will be in the therapy setting as if it were a normal 8-hour workday, or maybe they'll start with a partial workday, so maybe 4 hours, and they will basically mimic their job function or their job activities. And this is very common for more heavy lifting type of jobs, or factory workers, or people that do a lot of bending and lifting all day. And the concept with work hardening is that individuals will practice their work responsibilities and work activities in a controlled environment prior to returning back to work. Diabetes is becoming much more of a prevalent condition within the U.S. and around the world, so PTs are definitely getting involved in that. I've met a lot of PTs and PTAs that are involved in the performing arts. PTs definitely are involved in the emergency room and in urgent care centers. There's rehab groups for different sports, so golfers is just one example. There's PT clinics and health clubs. There's physical therapists and physical therapist assistants in the school environment. Hospice care, this is end-of-life care. PTs are definitely involved in this. Senior centers, senior wellness, PTs are involved with this as well as managing patients with obesity and the impairments that are related to that as well. Women's health is definitely a more common treatment area than it was previously. So women's health doesn't necessarily mean working just with women, but it has to do with the reproductive and urinary tract. So it can be males and females. So to give a definition of physical therapy, so it is the treatment of physical dysfunction or injury by the use of therapeutic exercise, modalities, or manual care intended to restore or facilitate normal function or development without the use of medicines, surgery, or radiation. So we're really trying to do more of a non-operative or non-surgical type of care to improve patient function. So part of your first discussion board was to look at what your definition of physical therapy was. Feel free to look back on that discussion board and see your classmates' posts to see if maybe you have a different view of physical therapy after being in the program for a couple of weeks.